have time to log on.
Morning everyone, I can see people are still joining. If you want to put into the chat who you are and what your role is, that would be really helpful, because it's really hard for me to see who's in the room with us otherwise. Oh, thanks Amanda and Hannah, thank you. Laura. I see some people are still joining us, so I was going to say I think it's slowing down, but maybe it isn't. But
Speeding up, Lucy.
I know, yeah, it is. Yeah. Hi Joe, I didn't see you there.
That's all right, morning.
It's really nice to see people in the chat introducing themselves, because we can see that we've got people from all over Mindworks here this morning, which is lovely. So we were up to 92 people now. Do you think we should 95? So I was going to say we could make a start, but clearly people are still joining.
Yeah, I reckon we're nearly at 100 now, Lucy. So I think we've given it a couple of minutes when you're ready.
Okay. Are you able to share the presentation? I can't hear you, Zoe.
Can you not see the presentation?
So the presentation header is on screen. So yes, I think the slides are there.
Else, but not because I've got it now. Thank you. So we're at 102. So let's make a start. Welcome everybody. Thank you all for coming this morning. It's really nice to see so many people, and from all different parts of Mindworks here this morning. For this is our third all staff conversation, and it's an opportunity for us really to update everyone on the different parts of the transformation project and programme that we've been going through. So for those of you who don't know me, I'm Lucy Ivankovic. I'm the Partnerships Director for Mindworks, and I'll be leading us through the start and the end of the presentation today. So we always wanted to start really with a big thank you to everybody, because I'm aware, and all of us are aware, that we've been going through a transformation, and change can be really quite tricky and difficult to cope with sometimes. And not only have we been having a lot of change this year apart from in all different parts of Mindworks. We've actually been delivering, superb services as well while we've been doing that. And so there's something around really acknowledging that and celebrating that. So there's a big thank you to everyone for all of the hard work and commitment to the children, young people and families of Surrey that have really needed our support over the last year. And so we wanted to really acknowledge that. But also, I think it's not just about saying thank you, it's having some recognition, I think. And we would really welcome people. If you want to give a shout out for your organisation or for your particular team or a piece of work that you've done that actually thinks, we just need to acknowledge that we're doing really well. And I don't think we always acknowledge that as well as we could. And so if you would like to share a story from your service or your team or something that you're particularly proud of, we'd really love to hear it. And I was thinking I could ask people to do that, and then it may well be that people go, oh no, I'm not sure that's something I want to share, but I've collected a few along the way and wanted to share with you some of the real things to celebrate, and sometimes they're amazing things, just brilliant things that we've done, and this week we've learned about how our ND waiting times are reducing, and that's just so fantastic for all of our colleagues on the ND pathway, and what a difference they're making. But to actually have our waiting list reducing, and I think it can almost become a habit, can't it, to complain about our ND wait times. And so to be able to say, actually, we've got colleagues that work so hard and are so skilled and talented, and not only that, they're working to reduce those lists and are succeeding in that, I think that's a real shout out. So we just wanted to really acknowledge that. We also had in our access and advice teams, we hit the first of, yes, thank you, that's lovely to see those reactions. We in our access and advice team, we hit none. We had no waits at all on the 1st of September in our access and advice. I mean, that is just absolutely phenomenal, given where sometimes we've had hundreds of people, hundreds of children waiting for assessments there. Another area that I wanted to mention was the Surrey Care Trust. I don't know if there's anyone from Surrey Care Trust here, but I went on a visit to the Surrey Care Trust recently, and they gave me a phenomenal time, but also gave me the opportunity to speak with parents whose children were receiving a service from that service. And it wasn't huge, it wasn't amazing like the ND weights are amazing. It was just really good quality, impactful work for children, making a massive difference, and that's what we do every day. So I really wanted to mention the Surrey Care Trust with that. Bernardo's out of hours ADHD service, I'm really lucky because Jenny sends me through feedback, and we've had such phenomenal feedback from parents who've been in such difficult times that they've then gone to ring an out of hours helpline and said, what, I just need some support, I just need to be able to get through the evening, and please can you help me with this? And their appreciation of that service has been absolutely superb. So I think it's really important to acknowledge the work that we do every day that's often unseen, and then the phenomenal outcomes that we get as well. So if anybody wants to share anything around that about their own service, please put it in the chat or just raise your hand now, and we'd love to hear about it. And I will stop talking for 30 seconds for people to have a think, do you know what, I really want everyone to know about this in my team or my colleague or what I've done. So please do share. I can't see everyone's hand raising if people are raising their hands.
So Lucy, I don't see any hands, but there is a note in the chat. That's
from Sarah. Oh, thank you, Sarah. The Farncombe Garden Group, lovely.
From our newsletter, and Mandy wrote something for our newsletter for us, and we've taken a successful group that we do in Working Garden in Dorking, and we moved the same group for ND children over to the west in the Farncombe Garden, and it's been a lovely feedback, and it's really nice to be offering that group in that space. So just wanted to put it there.
Brilliant. Thank you. That's really lovely. Justine, I can see your hand up.
Well, I was gonna think, is everyone being a bit shy? So I thought, I thought I'd share two things. So firstly, a colleague, Chloe, who works in ND in the admin team, she received some feedback from a family, just whereby she'd been able to help them and make sense of what was going on with their referral, and some really lovely positive feedback from mum. So I thought that would be helpful. And I was with school-based needs colleagues, so MHST colleagues, yesterday at a GP event. And the GP actually came over to Laura and Siobhan and acknowledged the really brilliant work that's going on in schools, and what difference that's making to primary care. So just two bits to share from me.
That's brilliant. Thank you, Justine. So lovely to get that external recognition from a group of GPs. That's just great, isn't it? And Renata is getting a massive shout out in the chat, which is really lovely, that the difference that she's making to her teams, and people enjoy working with her. Oh, it's all coming in now. It's getting a bit fast for me to read. That's the team. That's another one from you, Sarah. Michelle, about AAT admin. Yeah. Any more shout outs before I go on? Just that recognition. Christian, I can see your hand has gone up.
Yeah, I just wanted to add to our team, when we had this backlog that we had to screen for AAT, and how the team worked together to really help do the screening. It was very, very challenging, but all of them, we all gathered together and we discussed what's the best way forward, and we managed to help and got the screening done. So just wanted to shout out thanks for the staff that were helpful to do that as well.
Thanks, Christian. I mean, that made such a massive difference and contributed hugely over the summer. So thank you. Sharon, I've seen your hand up.
Yeah, sorry, I've only just joined, had to restart my laptop. I'd like to do a shout out actually to all of the community teams, school-based needs and AAT for working collaboratively in managing the demand in a timely manner for all the children and young people who are waiting to be screened, triaged, and then for an intervention. So I'd like to thank everyone for coming together and doing that. It's been really amazing, really amazing. And the navigation meetings as well, we received such positive feedback. So it's just lovely how people are coming together and working together.
Oh, that's great. The navigation meetings were on my list, and I thought, you know what, I'll just see if someone mentions it. So that's brilliant.
Yeah.
Thanks, Sharon.
Thank you. Thank you.
And then the community wellbeing teams across the county have been mentioned in the chat. Great collaboration, lovely.
And a hand from Amina, Lucy.
Amina, yeah, brilliant.
Yeah, hi Lucy, hi. Yeah. I thought, shall I say something or not? But I must say something, because we are quite fortunate. We get quite a lot of compliments via cards and letters. But one of our clinicians has been on a real roll recently. So David Morley, he did a secondment about a year ago in SEDS for a year, and he was working with SEDS and with us as well. And what's been fascinating, a year later, we've had a couple of parents recently write in to talk about their young people who saw David whilst he was with SEDS, and giving us report back on where the young people were at the time and where they are now. So that's been fantastic to see. So they're going to university, they're socializing, they're having just the normal lives of kind of the young people should lead. So that was fantastic. They kind of took time a year later to report back on how effective the work has been. So I thought that's worth a shout out.
Yes, definitely. Thanks, Amina. So I just think it just shows, doesn't it, what commitment and talent we have across Mindworks in such a broad variety of provision that we offer across Surrey. So yeah, it's lovely to hear us praising our colleagues as well and recognising our colleagues. So thank you. Lucy, you put in about our visit to Leatherhead Youth Project. That's great. Thank you.
And just to note, Lucy, the comment from Maristelle around the participation champions as well. I think it's probably worth it.
Yep, thank you. That's slid past, I think. Yes, thank you, Maristelle, because that drives all of us, isn't it? The voice of children, of young people, and our participation work. So, along with shout outs, there is the opportunity today to ask questions. And so we wanted people to be able to ask questions in the broadest way possible. So we are using, I think it's called Slido, which you can ask questions through this route, and you can make them anonymous if you want to ask questions anonymously, or you can put questions into the chat, or you can just raise your hand at the end of the presentation. So however you want to, but please do feel free to ask questions. We will do our best to answer them today and now during the meeting, but if we can't, and we will of course have a question and answer sheet that gets published afterwards as well. So if you ask a question later, we can also then put that onto the question and answer sheet. So we really would like people to participate as much as possible through this route. So whichever route appeals to you the most, then we'll try to answer those questions for you. I can still see some of the things coming in through the chat, but I can't read them all and present at the same time. So this slide is just covering the overall of the transformation. I'm not going to say too much, but just to give that overview, there's been 4 areas of our transformation, and access is one, and I'm going to talk a bit more about access in the next couple of slides, so I don't want to say too much more about that because I'll cover that in a bit. And then the locality hubs, and that's moving from our access and advice team into the locality hubs, and again we're going to be talking a bit more about the locality hubs and giving you an update on that. Lots of our colleagues work in school-based needs and in schools, and again we're going to be giving an update on that and where we're up to with that. And then in our ND pathway, and you've already heard me saying how brilliant it is that we've started to get waiting lists down. With the ND pathway, one of the reasons we've been able to start getting waiting lists down is going into shared care, and it's been quite slow to begin with, but we are moving, and children are moving out of our remit and then moving back into being cared for by their GPs, and those who are on steady medications and are able to move back into a primary care remit, we are starting to move children over there, so that is also helping. And for those of you who don't know, we now have the route for neurodevelopmental pathways through schools, and that's starting to work really well now. And we've also been given some additional funding, which is great, that we've been able to give to SciCon to undertake up to 600 new assessments. So all of that is really helping our transformation to be able to move forward. So if I could have the next slide, because then I'll talk about access. So all of our access criteria is now based on our needs-based groups through Thrive, and I want to thank all of the hard work, because it was very much a multi-agency team across Mindworks that came together many occasions, repeatedly came together to create this as our new criteria based on the needs-based groupings of Thrive. And obviously, if people know, Thrive is our model of delivery. And across each needs-based groupings, we have a different level of intervention and offer for people. So although we've got this as needs-based groups, I think in my head, it tends to be about a needs-based offer. And we are really moving from a medicalised model into a much more socialised model based on meeting need. And increasingly, I found myself saying, we're a needs-based service, we're responding to need. And so we recognise there's different levels of need for children and families across Surrey, and we want to respond to that level of need appropriately. Obviously, some children have a greater level of need than others, and we want to put more interventions and more provision where the greatest level of need is. However, that doesn't mean to say that we are not creating and building services where there is a lower level of need or a different type of need, but it might be a slightly different level of support. So those children who are under thriving, this is about recognising that, you know, we can all have temporary situations where we're finding it a bit difficult to cope, and that we would expect really increasingly for those children and young people to have their support met by families and their personal network, maybe some teachers in school. So under thriving, that's increasingly what we're moving towards. Our getting advice provision, this is around our early intervention and prevention element, and that's still really, really important. And we're increasingly putting interventions into schools through GPs, through peers. We have COOS available through that remit, and so that's really important around encouraging children and young people to get the support they need through a variety of different needs, rather than always coming through to a high level of need. And it means that they will get their support in a more timely fashion. Those children who have got needs identified that might need an evidence-based intervention, and this is increasingly where children can access support from a range of offers through our early intervention approach, particularly from Surrey Wellbeing Partnership Services, through our school-based needs, and short-term or sometimes in slightly longer through a one-to-one support or group work. So there's a broad variety of offer in our Getting Help services. And then children who have more complex needs, who need a specialist service, will be coming under the Getting Help provision. And we're talking about children who have got really concerning issues and are quite poorly, who need a medicalised model in response. So that will be our children and young people's community teams, the children's eating disorders, for example, sexual trauma, New Leaf, at the more higher complex end. And then getting risk support. I think this is an area that we've not always landed as well as we would like to, and we've done a lot of work around this recently. And while I've got you all going to be doing a plug, there will be a further workshop next month on risk support and risk management, because we've been able to, in conjunction with the needs-based groupings, really look at what we want to offer as a risk support model. So risk support is generally where previous help or past treatments have not improved somebody's well-being, or they've not been able to access that provision as well as they might, and we need a multi-agency response instead. We don't want to carry on offering what's previously not worked as well. So we pull together a multi-agency response around risk support. And so we have now written some new guidance around that, and wanting to share that with you. I think it's the 23rd of October off the top of my head for that. So please do come to that, because it'll be really important to be able to share how risk support and how risk management are going to be delivered in the future within Mindworks. So could I have the next slide? There's some really key messages that we need to get across here. And so, as I said right at the beginning, what we're really aiming for is more of a much more social model rather than a medicalised model. And with a social model and looking at a needs-based model, we're really promoting that you don't always have to have a diagnosis. You don't need a diagnosis to be able to access an awful lot of the services and provision that I've just outlined under the Thrive sort of framework. And a referral might not be always required. Children and families can get access and advice via our website, via COOS, and via lots of other community offers. Schools are increasingly becoming a really important element of our transformation and model going forward, and we're going to hear a lot more about schools, so I don't want to go into too much, but this was just recognising that schools, in the vast majority of circumstances, the schools know the child best. It's a place where children spend the majority of their time, apart from at home. And this was about moving from the GP referral route into schools, and being able to access appropriately within Mindworks through a school-based needs model. If a child is in crisis, the existing services will still remain available to them. And I have to add that largely we're talking about state schools, but for children in crisis, there is always that support available for any child across Surrey, regardless of which school they go to. So we are aware that 20% of children across Surrey go to have private education. They can still access all of our services through a GP or through early intervention. That's all still available to them. And referrals can be made for children who do need a specialist service. Oh, sorry, I've just talked about that, whether they're attending a state school or not. So that's always still available to them. And so I think the next slide, this is and I absolutely appreciate you can't read this, but we wanted to share with you. This is the message that's been going out to schools. We've used this is like a poster that's gone to all schools, and it's gone to GP surgeries, and Justine and her team have been doing a huge amount of work with GPs, talking about the access routes now and into Mindworks are through schools. And this is the poster that the GP surgeries have had, and it's the posters that all of the schools have had, that's really enabling them and directing them as to where the support is available and what sort of support that is. So although I appreciate you can't read it on a screen, it's a really great poster that's been very, very well received across everywhere that we've sent it. So I wanted you to be aware that that's the communications that we've been sending out. We've been continuing those communications. As I say, that Justine and her team have been visiting with GPs multiple times actually to get this message across. And so with that, I'm going to move away from the overview now and move on to Rachel and Lorraine to talk about how we're accessing our new hubs. So.
Thanks, Lucy. Hi, everyone. Yeah, myself and Lorraine have been, we'll speak to this slide here, but I think just reflecting on what we've heard so far is that, there is such a lot of work going on. It will be a continuous process of learning and tweaking and trying different things and problem solving together. So I guess the reason I'm saying that is to praise this slide, because this is where we are now. We're expecting to continue to see difference and shifts in our ways of children getting support. So it is likely that we will continue to take that learning and shift and iterate our processes as we go. So just to give you a brief overview of this, we start on the left-hand side. You'll know that GPs and for children out of school and in private school, as Lucy's just said, can be supported to send in referrals or requests for support in through our kind of secure portals. And then we've got the way in, the access way via the Surrey schools. And I know school-based needs colleagues are going to talk about that in more detail. So I'm going to kind of leave that section of the slide. Where young people are presenting with more urgent mental health needs and they need a more clinical view or specialist services, they are being seen and double check and move to those services. Those are our priority cases with the urgent mental health. But where those needs are not described as urgent, we've been working really hard over the summer to work through a number of kind of different ways of managing that. So I'm going to pull Lorraine in because she's been leading the Alliance Partner support as from the discovery team point of view. So I can't see
Thank
Lorraine,
you, Rachel.
but I'm presuming you're still there.
Yeah, no, I'm here. I'm hoping I haven't frozen. I am in the office, so apologies if I do freeze. And again, I just wanted to reiterate what Rachel and Lucy have been saying about the partnership working that's been happening over the summer. The outcomes for children, young people have been fantastic. I'm not going to say it's perfect, and I'm certainly not going to say there's not going to be tweaks along the way or bumps along the way. We do have a meeting in on a Thursday afternoon for the operational leads to discuss this, and it's been really good because we've been having open and honest conversations there, so it's been great. And this slide, it looks like partner support is bang in the middle, but actually it all works really well together. So we've been working with the schools-based needs because we've had to be flexible to meet the need. We've had to be flexible for the change of ways of working. So the team have been busy working with the schools-based needs team to have a look at how we can divert children and young people to the right services from there. And again, we've been part of the navigation meetings, which we've seen as a really positive outcome. I'm not going to talk about that because that's on our next slide, otherwise we'll jump one slide. But actually it's been really good. We have the partner meeting on a Thursday. Again, the name may change in the coming weeks to the risk management partner meeting, but we're seeing less cases coming back from partners that need discussing, which is great. And we're seeing lots of young people not bouncing back through the system. So we're clearly doing something right, working together. Think that's really it about that partner support bit, without me going into too much detail about the hubs. Is that right, Rachel?
Yeah, I think that's probably a good enough overview. And then if we move into the next slide, it'll give you a better idea as to, you know, what these locality hubs are. Sharon, do you want to take this? Do you want me to continue and then you can chip in?
Yeah, can you continue?
Yeah, I appreciate your sound's not great. So yeah, there's been a lot of prep work in the run up to the summer and over the summer to ensuring that there's a good spread of specialist experience and skills across our hubs, and so that has meant some changes for workforce, and as Lorraine kind of pertained to, that kind of flexibility of how we're working in partnership to respond to our changing context and our transformation as we go. So the locality hubs are kind of now in existence. They're a kind of a framework, kind of core part of that, and a core change to the ways of working are these weekly hub navigation meetings. And where the needs of a young person are a little bit more complex, not straightforward, might need a little bit of unpicking from a number of services, those meetings allow those conversations to take place. All the people that are involved have really come with a really, you know, positive frame of mind, and really considering how we can problem solve the really practical stuff that often we have seen as barriers to supporting young people. And we really want to make sure that that isn't an issue anymore, and that I think from the feedback we've had is that staff involved are really enjoying the collaborative approach that we're able to do, but also that actually so the children discussed within those meetings aren't kind of left hanging, that there's always been an outcome for those young people, which has meant that they're getting to the support they need in a faster way. What we need to remember, and I think colleagues have been supporting those, is actually where can Mindworks add that added value, but actually are those needs more social care related, and actually having those conversations where it might be at that particular time for the young person a social care approach is more appropriate. So this kind of picture shows all the kind of in the lines in the green circle show you all the bits that can happen from a geographical point of view, where those hubs are across the county. And obviously we would hope that in time, and again this talks to the process of evolving this, that we will have stronger links with primary care colleagues so we can influence how they are and what kind of needs they're sending to us, and we can support them with considering what else is available within the local setting, so that the clinical teams and school-based needs are working together. And so we're really just using the breadth of our experience and skills within any locality across the partnership to support young people. I think that's probably everything for now.
Can I just jump in there, Rachel,
yes,
and just say that it's been really interesting actually to have two of the members of my team supporting in this area as well. And it's around building those trusting relationships, and it makes working together so much easier. And we've seen that in the short time that we've been all working within the hubs, it just works. And it goes back to that trust, doesn't it? Because before you'd send an email and they'd go, nope, not taking that. And you kind of get into that battle, whereas you're in that hub and you're having those conversations, and it's just dealt with there and then. So I've only got positive things to say about what we've done over the summer. So I'm excited to see what else comes.
Yeah, that's brilliant, Lorraine. Thank you. I know in Northwest there's been some in-person ones which have been very well received, and people are really excited at the relationships they're building and for the outcomes for children and young people. So we're in kind of phase 1, and we'll be moving through the phases slowly. But as it says on the slide, we'll also be planning. What does it say we're going to plan? We're going to plan workshops to look at in each hub. So there'll be a south one, a north one, and an east one, and SWP and SBN, etc. will all be involved in that and invited. So we just need to get some dates in the diary. But we'll be further moving into the social work, our mental health social workers joining in the navigation meetings. We're looking at the youth counselling service joining. So we'll continue to build, but it started off really positively.
Yeah.
Thanks, Rachel and Lorraine.
Morning, my name is Michael Fern. I am the clinical lead for the Epsom SBN team, and today I was just going to give you a little bit of an update on what's been happening within school-based needs services, and specifically Epsom, where we've been doing a bit of a test of a new way of working, working towards some of our transformation goals. So all schools across Surrey will have an allocated linked worker who they can seek consultation and advice for around young people. However, in Epsom, in the last 9 months, we have been doing a test of new ways of working to think about being more needs-led. Our initial first steps in this was to think about collecting a wealth of data, and from people who are working with schools to think about how we could categorise schools in a Thrive model. So we have categorised schools with low needs, which would be getting advice schools, getting help school would be our medium schools, and getting more help would be our high need schools. So on this slide on the right hand side, we've got a number of ECHP plans in place, requests for ECHP plans, free school meals, looked after kids, permanent exclusions, send support within schools, levels of suspension and persistent absentees, rate of referrals to mental health services and low income families. So we used a lot of this data and a wealth of knowledge within the cluster working in Epsom to support categorisation of our schools. And then we went back to all our schools to think about how they felt about the categorisation. I think when we went back to have to all schools, we met with all schools, we were quite apprehensive, thinking a lot of schools would put themselves in a high rating. So we were pleasantly surprised when most schools either put themselves in the medium category or the low needs category. By categorising all schools, it helped us develop an offer that was needs-led, and how we could tailor the support and level of package that we offer to each school. So all the senior clinicians within the SBN team would be allocated to schools, so each clinician had 5 or 6 different schools of a different category needs, and they would develop an individualised plan with that school. We really wanted to push the model as much as possible to think about conversation first, so that all schools were discussing young people's needs with us to think about how we could get the right support at the right time for that person, whether that be a service within Mindworks alongside our kind of partner agencies, or if it was more of a social care need led. So really getting to understand the needs of the young person and think about how we can navigate the system to get them right support as quickly as possible. Rather than, I think, what we've seen previously is a bit of a scattergun approach from schools sometimes, where they would say, oh, we'll do a referral, but go and see your GP at the same time. So multiple referrals would come in, leading to lots of confusion for the family and not the best utilisation of services to get the right person to the right place as quickly as possible. So we're asking schools to take the leads in the referrals that they, the conversations that they think the support they need for young people. And we'll talk a little bit more about the feedback from schools, which has overall been very positive as well. And I think as part, oh sorry, just I'll hang on to that last slide for a second, please. So I think overall the feedback's been very positive. But but also it's led us to be able to work alongside our partners as well. So we have our cluster meetings, but with the main partners, I meet weekly to think about referrals and how they could support us, but also how we can work together as best possible to support the schools within the Epsom area. Epsom is the only area that's doing this test currently, but there is plans in the kind of near future to consider other areas that we're going to roll out from the positive results that we've had. I think as a school-based needs team, we always obviously think about the individual needs of a young person, but we also think what the school needs are as well. So thinking about the whole school approach and what we can offer. So we're really thinking about schools working collaboratively with us to think about what goals and targets do they want to achieve. So working alongside our educational psychology, support within the service and within Surrey County Council, we're really thinking about an assess, plan, review approach where we learn about the needs, work together with the school to have the best outcomes as possible, but reviewing that to make sure we are making the progress that we want. So based on the categorisation, each school will have a specific offer of support that they can have. We know that data can only lead us so far, but we're making sure that we're using feedback from schools and within the cluster to think about changing needs and where we need to maybe move more resource into different areas as well. So I think we don't want to be blinded by data. We want to think about how we can meet that need when it arises. And an increased emphasis on advice and support to schools, making sure that they know they're our first port of call. And I think the feedback again from schools has been very positive about being able to navigate quite a complex system where I think a lot of kind of safeholding for families is, oh, we'll speak to school, but we also speak to GP, and we want to move away from that model as much as possible and try to navigate to the right support as quickly as possible to get the best outcome for these young people. I'm going to pass over to Jo, who's going to cover the next slide.
Thanks, Michael. Yeah, I get the lovely job of sharing the positive feedback from the Epsom and your test. Which I think quite speaks to itself on the screen there. But I think one of the things we wanted to highlight in particular was the feedback that we'd had around that named link for the school and the key role that link worker is playing. And the fact that the schools that you mentioned in the test really gave very positive feedback about the level of contact that they'd had with their link worker and that way of working. And just to build on the comments that have been made already around collaboration and partnership working, to say that we're really actively working together as a whole team, aren't we, to think about how we can maximise the opportunities we have to work together and create those really effective processes with the new model to get those referrals flowing through and things as well. So yeah, just really, really great that the feedback has been so positive from that test and any learning we're taking forward and building that into our thinking going forwards.
So thank you, everybody. Yeah, I was reading the chat at the same time as thinking about responding to everyone, and so there's some stuff in the chat that's really helpful. And Freya, you raised about, how do we work in partnership, and that was the first thing that was what's next is this working in partnership and how important it is. I can see, Freya, that Rachel has started to respond to you, which is great. And I think there's something really important about knowing what's around, what's available to us and what is around for us, and knowing all of our partners. And Lisa put into the chat earlier that she and I had been to Leatherhead Youth Project, and while we were there, a young woman came and had a chat with us, which was really lovely. Just off the cuff, she just came and said, I'm going to come and say hello. But she had been referred to Leatherhead Youth Project from a SIPS community team, from a Children and Young People's community team, and they'd thought, she's finished her work with us, but actually needs some support in the community, and referred her on to Leatherhead Youth Project. And she was absolutely loving the support that she was getting there in the community. So there's something really important about really knowing what's around for us. And I also wanted to just mention that Cooth is very much still there. I think somebody put in the chat, didn't know Cooth was still around. Yes, we still commission Cooth. They provide brilliant service, and they are at the moment approaching people to come and talk to their team meetings so that you know what sort of offer they've got. Nikki, you've mentioned that our diagram is incorrect. I think we can now correct that. Thank you for letting us know about that. And just something that came up this morning around Epsom and Ewell, and as Michael was talking, I was thinking we just need to remind everyone that it's not just Epsom and Ewell High School. This related to all of those schools in that area. So the pilot that we ran, and that we've just shared the results of that pilot. Joe talked about that. That was across 22 schools. So it's not just one school, and I think that's become really important. And so we are looking to work much more closely with primary care colleagues, increasingly around an increasing neighbourhood team models working across Surrey, but it's about understanding what's out there for us and learning about that. I think that's really important. We are continuing, people will be aware that Tavistock and Portman, their contract within Mindworks ends at the end of this month. We are continuing to lead the development of Thrive across the system, and we do now have a Thrive induction pack that I'm really grateful for Tavistock and Portman for doing. They finalised that in August for us, and so that's part of our training, our Thrive package going forward is the induction that people can use when they first come, and it's a really good overview of what is available, and a good overview of how Thrive works really, and all of the principles of Thrive. So I think that's a really great way to start your career within Mindworks. And then we also will have some risk management training coming out following the workshop. And I can confirm the workshop is the 23rd of October. I've seen some people in the chat asking about that. We will also be sending out some information, and it's going to be in the newsletter, around the way we work in Mindworks. And so there's going to be 3 documents coming out from there. It's the warm handover that Renata has done so much work on, which has been really helpful, and I think links into some of the things in the chat. We're going to be sending out equality and diversity and inclusion commitment for Mindworks, and we're going to be sending out some guidance that a task and finish group have worked on with regards to session length, and that was in direct response to responding to children and young people telling us, we don't have enough sessions, we want more, and about how we can manage those expectations of those children. So we do need your help. I'm really proud of Mindworks as an organisation, and the very many different organisations that make up Mindworks. But we need your help to ensure that our messaging is really clear and it's consistent to achieve the changes in our referrer behaviour that we need, which is to stop referring through GPs and start referring through schools. And that was around the poster that we showed earlier. So that's where we're going next. There's a few updates, and some things that I've just talked about will be in the newsletter that's coming out at the end of the month as well. So I did say at the beginning around questions, and so this is the time. If you've got questions, then please send them through. If they're in Slido, that's great. If you just want to put them in the chat, that's great. And we will try and answer them. If we can't answer them now, we will put them in a question and answer format later. So Eamon, I think you were covering the Slido. Some questions you put into the chat. How will we manage the influx of young people?
Yes, there are quite a few. There are about a dozen questions there, Lucy. They're all quite, actually, there's some very important questions, and actually they're all quite distinct. So it's difficult to group them, but I will add them, and you can take them as you see fit. Okay, brilliant. Rachel, have you come in to ask a question or possibly responding to one? You're on mute, Rachel.
I was just going to suggest I can quickly respond to the needs-based grouping one, if that's helpful, but otherwise.
Perfect. Yes, thank you.
So I know we've shared a very high level picture and slide of the needs-led groupings, and again in this forum it's really tricky to know how much detail to give people because we're just flashing things up in front of you. To reassure you, there are detailed slides about each Thrive-based grouping within a document, and that is we have reviewed it again. So we did a lot of work earlier in the year. Joe Fulter and I have reviewed that along with other colleagues very recently. And we're starting to plan how we share that widely with you and how that becomes part of our training package or something, so that you can really kind of get to grips with how it is reflected within our evolving Mindworks offer. Because as we've talked about flexibility and we've talked about change, it's important that you do have the details in that, so that yes, that is part of our plan going forward. So I hope that is reassuring.
Thanks, Rachel. I'm just going to come back to the first question there around, for people who haven't seen it, this is how will we manage the influx of young people and the rising mental health needs while staff are leaving and services are diminishing? And I'm presuming this is coming back to yes, we've had a need that we've had to come back to budget as far as we're possibly able to come back to budget within Mindworks, that we were overspent. And we have done a phenomenal job, and everybody in Mindworks has done a phenomenal job of getting us back to budget. In terms of services diminishing and staff leaving, I might just challenge slightly services diminishing. I think we've got superb services within Mindwork. We've been able to celebrate them this morning, and people are so proud of those services. And so while diminishing is one word, I think there's if people have ever heard me talk before about, yes, we need to take money out of the budget, and I've constantly said, we can't do more for less. We can't. No one can do more for less. We can't do the same for less. What we can do is different for less. And I think that's probably what we're aiming to do, is we're aiming to do something different. And so we may have some staff leaving, and we may have services looking different and feeling different, but I think it's about using all of the resources available to us, as we've heard through the network meetings this morning, and how positive those are. So we need to be thinking about how we're doing things differently. And we do need to recognise, of course, that there is mental health needs amongst children, and that's difficult for us to respond to at times, but I think we're doing very well with that, and we are thinking much more creatively about how we do deliver things differently. And so I would challenge slightly the word diminishing on there, because I think we've got really superb services that we should be proud of. So Aaron, I don't know if you were coming back on that, but I can see Aaron and Justine have got their hands up. So.
Yeah, sorry. I mean, firstly, just thank you so much for this opportunity today and hearing of the latest updates. And just really great to hear of all the great things going on and across Mindworks, and all things that can be celebrated. So thank you for that. I guess I do want to raise the issue about the sense of teams feeling diminished, and I would absolutely highly agree that our service has been diminished, because I'm based in SIP's Community Team Southwest. Now, I guess part of the Mindworks Hub South. We are a brilliant team. We've got some fantastic clinical and non-clinical staff, and I absolutely celebrate all of them. However, we have had 8 staff members cut basically overnight, which is about 30% or so of our clinical workforce. On top of that, there's been increased demands of the people that have been left, in terms of obviously supporting the access and advised triaging, which Christian very kindly mentioned at the beginning. We're in a new way of working, where we're also adopting neurodevelopmental assessments and treatments for those cases where there's significant clinical and risk severity. So we're getting more asked of us, and yet we're hugely diminished in terms of number. Not diminished in terms of the excellence of the care that each individual is trying to provide, which I think is what you're alluding to, Lucy.
Yes,
but
thank
absolutely
you.
diminished in number. And I think, as well as the sadness of losing colleagues with really fantastic skills and expertise and knowledge, it's also it really affects what can be offered, and in terms of the morale of the team, it's really impacted on as well. And I'm just really concerned about safety, and really concerned about sustainability, because obviously in these recent years we have been operating in a Thrive model. We've been working very collaboratively with other agencies and doing all of that. but I just can't see how we can function not just effectively, but in terms of safety when we're such a, reduced in number, and the impact it's going to have on morale and sustainability in the longer term. So I'm sorry for raising concerns when I know there's been a lot of celebrating of successes, and I absolutely appreciate those successes need celebrating. But I think I just want to raise, actually significant concerns at the same time.
Aaron, thank you for raising the concerns. I think any time of change does have impact, and I think it's fair enough to raise those concerns, because it is really unsettling, and change does bring difficulties, and I think it's fair enough to raise them. And I'm really glad that we've understood the diminishing, and I'd misunderstood your use of the term diminishing in terms of number. And yes, we have had to do that because we've had to look at getting back to budget, but we're aiming to do that in a really safe way, in the best way that we possibly can. And I can see Justine's got her hand up. I didn't know, Justine, if that was in response to this and you wanted to come in, because I know it's one of your teams. So
yeah. Thank you, Aaron. And you do always advocate on behalf of the Southwest in particular, but I know that you're passionate about what happens, I think, in the across the CT services. So just to acknowledge, there is absolutely not any diminishing at all of the passion and the experience, and that strength of feeling about doing all that we can for children and young people. It is, however, the case that we've had to recalibrate workforce across the Mindworks hubs, and that's been incredibly difficult for people. And I think we do recognise that Southwest have had to bid farewell to colleagues who perhaps have moved to other geographies. In terms of the kind of the facts around workforce, actually our turnover is stable and just below the trust average. It is also the case that our vacancies are low, other than where we've got new services, so for mental health support teams, for example. So I think just important to hold that in mind. And I know that there have been there's a sense of the loss of some specific roles. So the urgent care pathway colleagues in particular. So we are hearing that, and the work that Sharon and the team are doing is making sure that those functions continue to be a part of how we provide our Mindworks hub services going forward. I think it is there's not enough investment in the specialist end of provision. I think that we are too stretched. So would echo your concerns there, Aaron. I also have to recognise that we are spending 1.2 million more than we have in the contract at the specialist end of services. So it's really difficult trying to kind of balance those two things. And then just to say, with regard to your concern around risk, we absolutely should be reporting any specific risks or safety concerns, because it is our determination as a senior leadership team. Perhaps Phil's going to say something here, that anything that feels unsafe or risky we should know about in order that we can take the appropriate action. So please do reach out if there are some specific things that you're concerned about, Aaron.
Thanks, Justine. I can see some hands have come up, and I can see there's a lot of questions in the chat, and we've also got 4 minutes left. But I'm going to go to Phil, because it may be that, Phil, you're continuing that conversation or something else. But if I come to you first, Phil.
Yeah, so I'm going to draw on a couple of experiences. So as Justine says, and as Aaron rightly says, how we best track risk, mitigate against risk and safety is really, really important. However, with my sort of staff governors hat on, and I have raised with the trust, because I've heard it across divisions, including our own, that the data that the trust, or at least some of the data that the trust uses in relation to turnover, in relation to sickness, in relation to exit interviews, doesn't tell the whole story. So I'm keen, we're all keen to both use measures that rightly or wrongly are used, and also intelligence on the ground through meetings like this to flag up, actually as true a picture as possible. And from a very medic specific perspective, but I think there are themes that apply across the whole of the workforce, is I continue to raise on a weekly, if not on a monthly basis, either through safety huddle or through supervision with my line manager, the chief medical officer, that whilst I have a lot of confidence in the work that we're all trying to do, and do, I have less confidence in the external environment in which we're trying to bring change. So the speed with which GPs do more, the speed with which education do more, and all of that. So that's a sort of perspective from me that I think is validating what everybody is saying, but also saying that there is more to do if we're going to reflect the truer picture and actually enhance the sustainability of what we're all doing.
Thanks, Phil. I'm just going to answer one of the questions in the chat, which I can probably answer straight away. There was a question in the chat around, can one person gather all the current SERI voluntary services information across SERI and share on the intranet? We don't have an intranet, but we can share with staff and keep everyone updated. SERI Wellbeing Partnership have certainly created a document that has the outlines of all the provision that is covered there. And there's also other sources of information across SERI as well. So I might go and come, I know Lisa Tanaka is on this call. I might have a conversation with Lisa about how we can progress that. So I just wanted to at least answer one other question, but Christian, I can see you've got your hand up, and if we can come to you before the end of the meeting, because we're supposed to be finishing at 12. And
yes,
it's not
I'll be very quick.
left.
I was just adding to what Aaron raised a concern, and I think one of the issues that we're going to be having in the form of the transition, I acknowledge that all the work that's been done through that transition, and especially when we are sorting early health intervention based on the iTribe, so a lot of the triaging and screening will go to our partner agency and school-based needs. What we are witnessing now in the near future, hopefully, am I correct, is that we are now getting more routine initial assessment being booked. We've got about 49 at the moment that is yet to be booked. And so, and then also with that, in terms of treatment wait lists, so specialist teams within CT, treatment wait lists like psychology and psychotherapy and family therapy, this will be impacted. It could be, whilst we're going through the process, this will kind of gradually sort itself out. But I think there's going to be that competition within how we're going to be able to manage more assessment within a routine assessment, and then treatment, the challenges or long wait for treatment. Because, and hopefully, if obviously we can mitigate a lot of cases coming into CT by the screening in which goes to school-based needs, then that would correct itself. But I think that's a concern, because obviously in the last week we had about 6 urgent cases that needed to be assessed within, if you look at the time scale, but we've only got 1 UCP worker. And obviously I think we're looking at maybe clinicians will be offering to do some assessment, but then that needs some kind of training for some of the clinicians or some who haven't done UCP assessment for quite some time. So these are some of the things that we're picking up. It might correct itself as time goes on, but I cannot agree with Aaron in terms of how it's impacting CT teams.
Sorry, I'm just going to come in here very quickly because I feel I have to respond. Christine, I'm sat just behind you. None of this has been escalated to me, so I think we need a conversation. And also, all the clinicians can do urgent. There isn't an urgent care practitioner anymore, but the urgent care pathway remains, and that's been made very clear in lots of emails and meetings. So I just wanted to clarify that. Thank you. Sorry, Lucy. Thank you.
Okay.
That's okay. Thanks. I think we've run 2 minutes over, and I can see people are leaving. But I'm really delighted to have had so many questions. I'm delighted that there has been, I don't know if brave is the right word, but good conversations. People have had the chance to raise issues and people have been able to be listened to there. I think that's really important. I think we are an organisation that is in change at the moment, and with change comes things that some things work, some things we're trying out. But I think we're confident that the transformation that we've put in place is moving in the right direction. It is moving in the way that we want it to. We are beginning to see the results of that, and we've seen that today in the meeting with the celebration of all sorts of services. And I think that's something that we really need to hold on to, and we need to remember and celebrate ourselves probably more than we currently do. I've seen all of the questions in the chat. I think we're up to 19 now, so I'm delighted that there's that many questions in the chat. But and we will get round to them, and we will answer them and be able to come back and give some responses to those questions. We're aiming to have these meetings probably once a quarter, and it feels as if they're beginning to work now. We're getting a good framework for them, so hopefully we'll be able to meet again later on in the year. So thank you all so much for staying to the end. 96 of you stay to the end. Thank you, and have a great rest of your day.